communication. When students at a young age group, they are developing speech and language, when there is loss of teeth, this leads to pronunciation problems and difficulty in language and speech. Hence, we need to take care of all their primary and permanent teeth for better communication. Coming to social well-being and self-confidence, they are at a very tender age group with peer pressure. Loss of teeth impacts them mentally. There is a tremendous impact on the mental well-being. So, early loss of teeth in children leads to mental problems as they progress into adolescence and adulthood. I can tell you a personal, experience. Yesterday, I did a surgery for a wisdom tooth for a young adult. The surgery was done in the morning. She came to me in the evening. It was a wisdom tooth surgery, which you can expect to have mild swelling pain. So I thought she came back for medication refill. But she presented to me with a completely different problem. She told me that her front tooth is broken when she was trying to eat something. So, in spite of her having the wisdom tooth removed with a bit of a swelling and pain, she wanted to fix her front tooth, which was half broken. The reason being she had a social event to attend. So, imagine if this is the impact on adults who can understand things, how much it would impact psychologically children who have lost teeth at a very young age group. So, that's why this dental screening and awareness program in school kids is very important. And overall, when you establish a disciplined healthy practice at a young age group, such as proper brushing techniques, good oral hygiene maintenance, this impacts on the overall health of the patient or the student being taken care of as they progress in their life. Finally, as we always say, prevention is better than cure. It is always good to intervene children at a very young age group so that further costly treatment at a later age group is being prevented. Now, why do we involve schools and teachers? In all developing countries, this is a routine, as teachers and school play a very major role in the health as well as the development of the students. So what is the role of school and teachers? They promote actually oral health, and also they could educate the children on good oral hygiene maintenance. They could also collaborate with professionals for dental screening and examination. Teachers can also encourage parents in the Parent Teachers Association to ensure daily oral hygiene measures and to encourage them to have their children taken for regular dental visits. Now, I'm just going to just take you through a very short, background on the physiology on what we commonly say as dental caries or tooth decay. Why does it happen? Why do we see these cavities in tooth? For the cavities to arise in tooth, you need three main factors, which is the host, which is nothing but the tooth itself. Then you need sugary food items, and third thing is bacteria. So these are triad. All these three things, when they have come in a combination, we develop cavities. So basically, there is a tooth structure, and somebody eats a sticky, sugary food. It goes and sticks onto the tooth structure. Now, the bacteria in the mouth, particularly, namely Streptococcus mutans, Lactobacillus, they act on these sugary food items, and this releases acids. The acids are nothing but lactic acid, which can act on the enamel of the tooth and causes demineralization. They start eroding the enamel, and this leaches out all the calcium and phosphorus from the tooth surface, and this leads to the development of cavities. So to tell you very simply, these are the three factors. You need the tooth, you need the sugary food items, and the bacteria. And another important factor is time. If a person is being exposed to this kind of sugary food item for a longer duration, there is more chance he develops more cavities. That's a healthy tooth. You see a sticky food being attached to the tooth surface. Now the bacteria acts on this basically, which is, sucrose, glucose, or fructose. These fermented sugars, when the bacteria is acting on it, releases acids which can damage the tooth structure. Now, initially, when it is superficial, the kids or adults, they say there is very mild sensitivity or no symptoms at all. When it's getting deeper, they start developing symptoms such as pain and swelling and discharge. So I think, I've briefed you on how this tooth cavity is developing. So now, from as we know how these things develop, we would be able to intervene to block one of these, the factors which can help us, to prevent cavities. Now, coming to, the specific role of teachers, you know, you're all very busy people, and handling kids is always a challenge. You could ask, about if they have any pain in the tooth, or how's their oral hygiene, how many times a day they brush. So that is one thing. You could encourage the students to have good oral hygiene, and brushing techniques we will also demonstrate. You can ask them to do proper brushing techniques. Particularly, you could emphasize on proper healthy diet habits, because that plays a very major role. As I told you, you need a tooth, you need food which can release, the fermented sugar, and the third thing is bacteria. So if you could emphasize on the diet habits for the kids, that'll be of great help. So you would become actually a partner in the child's oral and general health, and by which over a period of time the child will become the champion of its own health. So, what do you need for these pre screening? No fancy equipments. All you need is a good light, just a good torch, and you could use your mobile torch. Now, when you're examining, it is very easy to examine the lower teeth. You will just look right into the mouth and you can look at the lower teeth. The challenge is the maxillary or the upper teeth. For that, the patient the students have to be seated comfortably and extend their neck slightly above and look upwards, and the teachers can examine the maxillary teeth as well. This is just a pre-screening. We would be doing the screening anyways. So what would you be looking for? You would be looking for discoloration of teeth, black spots, brown spots. As you could see in the picture, this is how it looks. This is nothing but bacteria acting on sugary food item, causing acidic damage. Now, our saliva, nature has given, saliva to have a protective coating called salivary pellicle, which forms on the tooth. It prevents any acidic damage. But this salivary pellicle on the long run, what happens? Bacteria can go and attach themselves on this, and that can cause plaque, or calculus. And this leads again to caries. So this, what in this picture, what you see is something called, we call it as a rampant caries. Caries or tooth decay is spreading from one tooth to another, and this is basically with due to two reasons. One is the diet habits. Second thing is improper oral hygiene measures. Now, when this happens, this affects the permanent teeth as well. This leads to loss of teeth at a very young age, and the permanent teeth can grow in the right position or may not grow, and there could be spread of infection as well. Second thing, what you would be looking for as teachers, I would like to emphasize this point. First thing, when you're examining the kids, please look for discoloration, black spots, stains of any sort. That is a kind of an alarm. Second thing, what you would be looking for, you would see in the tooth that there are some crowding or malalignment like this. Now, this very clearly shows that this student has been having some sort of a tongue thrusting or a thumb sucking habit. So you see, this is a malalignment. So when there is crowding of this sort, we have certain treatments which can, it's called selective extractions of teeth, which can prevent malalignment as the child grows. And there are certain, appliances, orthodontic appliances or braces which you could wear to break these habits. It's very important. Children have certain parafunctional habits, so these can be broken. And if you see here in the third picture, the lower teeth is much farther ahead. It's placed in front of the upper teeth, which means that is a kind of a malalignment. If this is picked up at a very young age, we could do treatment which will modify the growth. We call it myofunctional appliances or growth modification appliances. They can be used so that when the patient grows, we could avoid surgical intervention. So, coming to the dietary habits, the teachers have to emphasize the kids. You could even give them awards and encourage and motivate other kids, by giving awards to people who have good oral hygiene and who take healthy foods. What are the things to avoid? First thing is sugary food. When I talk about sugary food, then you could ask me, doctor, then they are kids. It is very difficult to prevent them from having chocolates and candies. So what we should do, once they have candies or chocolate, be it at school or at home, they would have to immediately rinse their mouth. That is the first thing. And drink plenty of water. So things to avoid would be, if you can avoid, it is best to avoid sugary foods, particularly chocolates, toffees, candies. Second thing to avoid is carbonated or acidic drinks. We see a lot of carbonated drinks, canned drinks. All these release acid. As I told you, these acids can act on the teeth and cause acidic damage. Third thing is sticky food. Anything which is sticky can get stuck to the tooth and cause the bacteria to act on them and lead to cavities. And always have sweets or chocolates along with the meal, not as in between the meals, because when you're having it along with the meal, what happens, the other fibrous food what you have can self cleanse the teeth. And second thing, the acidic damage on the tooth is less, because the digestion process already starts in the mouth itself with salivary amylase. So the best thing would be to avoid sugar. If not possible, at least after a sugary meal, have a good rinse of your mouth, and always have any kind of sweet along with the meal, not as a separate meal. Now, what could you do? Always eat, teeth friendly diet. I mean, what do I mean by that? Rich, fibrous food like our routine vegetables, fruits, and diet which are rich in calcium, particularly, milk, cheese, yogurt, have a lot of nuts, and which it increases the whole grains and, proteins in the diet. And most important, drink plenty of water. I'm from Chennai, Tamil Nadu. There was in government school, they used to have these school bells rung every, there was this, and it during that ringing of bell, it is called for water breaks. They are, students are encouraged to drink water. So an adult should drink at least 2.5 3 liters per day. So half of it is well fair enough for the kids. So drinking plenty of water increases the salivation in the mouth, and saliva is a natural protector of caries, because it forms a protective layer. Having said done, that is the reason why we always encourage everyone to brush in the night. The reason is, mornings we are talking, drinking, there is activity, salivary secretion is there. But in the night, we are at least 7 to 8 hours, the salivary secretion comes down. So when you brush and you clean all the food debris from your tooth, this prevents cavities. So it is always, advisable to brush definitely before our sleep time. So, what are the oral hygiene measures which are good for health? We'll have to rinse after every meal. Brush your teeth twice daily, definitely, particularly before your sleep in the night. And visit, a dental doctor at least once in a year. Now, I just wanted to, brief you on this brushing technique. Now, we all think, what kind of, toothpaste does it work? It's all finally coming down to the brushing technique. It doesn't matter what kind of toothpaste you use. Of course, toothpaste with fluoride helps to prevent cavities in children. But the technique is what is more important. You will have to take a small peanut size amount of toothpaste is more than enough. Okay, and then you start, doing circular motion in the front of the upper and lower teeth. You just gently do circular motion, or you can do up and down motion. Okay, that is the first thing you will be doing, so that you're cleaning the outer surface of the upper and lower teeth. Second thing, you will have to hold the brush vertically as seen in this picture. You go in and start brushing the inner surface of all the upper teeth. Okay, so now you have completed the outer and the inner surface of upper teeth. Similarly, you will hold the brush vertically to brush the lower portion of the inner surface of the lower teeth. So you have completed all of them. When you come here, you will have to start brushing the biting surface. Always, the biting surface, you can go front and back as the arrow mark shows here. Okay, and then repeat the same thing on the other side. And a word on this is you'll have to also do a tongue cleaning. Buy a tongue blade separately or a brush separately for the tongue to clean it. So why do we have to clean the tongue? The coatings on the tongue can act as a nidus, or it can act as a nest for the bacteria to settle down, from where they can go and affect the teeth as well. And nicely rinse your mouth. And as we have mentioned here, a bright smile is always good for the right health. And that will be our motto during the camp. With that, I would like to conclude and thank you once again, all the respected teachers who have taken time uh, to attend this seminar. And we will all see you soon, inshallah, during the camp. Thank you.
Thank you very much, Dr. Kamal. Thank you. That was very nice presentation. I hope the participants have enjoyed it and learned a lot out of it. Uh, Teachers, I just want to tell you one thing, that we will be sharing you a group link, IDMF camp group link. So you need to join in that link, and any doubts that can be cleared in that group. And for those teachers who were not able to join because of the number of participants, so we will have one more presentation for them, so that they can be well aware of what is happening. Secondly, I would like to request the HMs and the IDMF participants to stay for 5 minutes after the vote of thanks, so that we need to discuss something.
Dr. Saab, can you please ask some of the teachers if they have any questions
Yeah.
to ask? Yeah.
Teachers, if you have any doubt, you can feel free to ask. Dr. Kamal is here.
And the teachers, they shouldn't hesitate and they shouldn't be shy.
Teachers, you don't need to be you need to be free. Like, there's nothing like this. You can ask freely. You can speak up. Unmute yourself and speak, please.
I request Ms. Samira to unmute all the participants.
If there are any doubts, anything, teachers can feel free to ask.
We are more than happy to answer.
Yeah, we are more than happy to answer.
Champions of oral health now, because the number of students are enormous, and your step in their development is very, very important. And this is a first step we are doing, and then as we progress, there are other preventive measures which like fluoride application, pit and fissure sealants, all that comes at a later stage. But from now, this is our first step towards creating an awareness, so that each one is responsible for their own health. So if that is inculcated at a very young age, then we will be able to create a healthy society in the future, inshallah.
See, let me just brief you one or two things, add on to this, that the population of world is 8 crores. And in our mouth, there are 8 crores microorganisms staying in our mouth. And they quarrel among themselves for the placement. So you need to understand that how much acid is developed in your mouth. And mouth, the bacteria which is present in your mouth, if you have gingivitis, if you have more calculus, it goes through your arteries, through the blood capillaries. This is brief, I'm telling, without any medical terminology, that goes to the outer layer of your heart, that goes to your bone, that causes infective endocarditis, that causes rheumatoid arthritis. So this is the importance of oral health. Like if you, from the tender age, if you teach the children that how to brush your teeth, how to keep it like clean without any microorganisms. Streptococci is the most common microorganisms present in your mouth. So if you teach them how to maintain your oral hygiene, in future when they grow up, like why there are so many cardiac arrests at the age of 30s, 40s, why there are so joint pains nowadays, what is the diet we are taking nowadays, how it affects your daily life. This all need to be considered. So I don't want to uh, uh, like take up more. Like I would like you to please ask questions if you have any doubt. So please feel free to ask questions. We will be very much happy to explain you. So show some interest. Like that means if no questions means that either you have understood everything or there is nothing like.
No, with due respect to all doctors, I think they have understood because it was very clear, the presentation and the slides and everything. Still, if we have doubts, I think the teachers can raise questions on the group where the link will be shared with us.
Yes.
So by and by, I
Mr.
think.
Tawfiq Pashi.
Yes, sir. Assalam, sir.
Walaikum assalam.
Sir, which toothpaste is better to we will brush? Which toothpaste is better?
It depends on you. Brushing technique should be good.
Okay.
Assalamu alaikum, sir.
Fareen Irshad. You buy the cheapest one, but brush properly.
Good afternoon, sir.
Okay, thank you, sir.
This is Pai. I want to find out if a children is already having that calculus, how to
Yes.
remove it.
You have to come to a dentist and he will be cleaning it with scaler.
Okay, so no natural remedies, nothing is like that, so that
No,
we
it
can
has
use
to
it.
be. It calculus. What is calculus? Calculus, the plug. Initially, what happens there is plug is formed. The plug calcifies into calculus, which becomes a very nice media for microorganisms to generate. Like they multiply very fast in that. So that calculus has to be removed. Scaling has to be done every 6 months.
Okay.
Whether you have calculus or not. I think Dr. Kamal will be explaining in a better way because he is in this presentation mode now. Yeah, Dr. Kamal, please. Sorry.
I mean, I just want to clarify. You're talking about the cavity, the black thing on the tooth, or you're talking about calculus?
Calculus, sir, that yellow color substance that is formed on that.
Okay.
I find it in most of the student, they are having that yellow color substances there on their teeth, sir.
See, now
Deposit.
that's what we
Dust,
used to
I think so.
examine. That's exactly what we will be doing. Now, usually, the calculus is very, the formation of calculus is less in compared to adults. In children, it's very less. So, if it is yellow color, there are sometimes you can have fluorotic stains, intrinsic stains which are there. If it is a cavity or calculus can be removed, as Dr. Salim said, with the usual scaling. And if it is a cavity, see now, things have advanced to that level that it is all treatments are first of all painless. even for children or adult, it is painless. Second thing, we do everything, to preserve the tooth structure. Even if a child loses a tooth, there are certain things like space maintainers, which will maintain that space for the permanent teeth to erupt into the right position. So and there are also stainless steel crowns for the kids. After, treatment for root canal is done, these, crowns are placed till the permanent teeth erupts. This is regarding school age kids. But coming to the adults, same thing. We don't do extractions, root canals are there. Even, if the tooth has got poor prognosis, worst case scenarios, you'll have to take out the tooth. Then there are ways to rehabilitate by using implants or bridges. So this is just to give you a very wide idea. Now our focus on this school health program is because if things are learned and done at a very young age group, and that prevents, when they progress to adolescents and adults, to have bigger dental problems.
And it
Thank you.
differs from children to children also. Like some children are they high calculus formers because of the more saliva in the mouth. That's why usually the lingual side of the lower teeth is more prone for calculus formation because of the minerals that comes from the saliva that deposits and forms the calculus. Any other question?
There was one teacher who was asking, about toothpaste. So
Yeah.
don't worry about all these, toothpaste, whether, it is gel. Basic concept is, the toothpaste, which is not very brightly colorful. Normal toothpaste is ideal because sometimes these gels with bright colors, some chemicals in them can cause oral irritation. Second thing is, most important thing is the brushing technique. Just we'll have to follow whatever you eat, rinse your mouth straight away. We don't do that very often. We have coffee, tea, but we don't go rinse our mouth. So that is the first thing.
Abrasive,
We have to
sir.
encourage children as well as adults ourselves. Second
Less
thing is the
abrasive.
brushing technique. That is what is important, which we will elaborate anyway. We have pamphlets on demonstrations on how to do the brushing.
Abrasive also. If you can tell something about abrasives, Dr. Kamal. Abrasives in the toothpaste.
Yeah, abrasives, correct. There are toothpaste which are specifically, they can abrade, the tooth structure, enamel. They are small, fine particles. They are specifically used for certain patients with heavy stains. Not all of them should be using. You see these whitening toothpaste in advertisements, they show immediate sparkling smile. If they contain abrasive, that is not for normal patients. So all we have to do is proper, brushing technique, and drink plenty of water, rinse our mouth, focus on the diet. These are the things will be our focus.
Any other questions, teachers? Okay. I would request Dr. Nahid Madam to please give a vote of thanks. You are muted, madam. Can you unmute yourself?
Yes. Am I audible?
Yeah.
Yes. Assalamu alaikum and good afternoon once again to everyone. On behalf of the school principal, Dr. Muhammad Imran, and on behalf of all the HMs and teachers, I thank wholeheartedly to the complete team of IDMF, especially Dr. Salim, Dr. Maniar, and Dr. Kamal for this brilliant presentation as to how to do the initial screening phase 1 for the children of the school. And we do understand that such initiatives are very necessary for the school students because this is how we can get all of them on the same page to lead a healthy lifestyle. So as the teachers are now equipped with this training, I think they can do the initial screening and then come up with the suggestions as to who are the children who will be identified for the second phase, who will be attended by the team of doctors from the IDMF. And I think this was a very good platform for all of us to diagnose what are the defects that the children are having and how we can go about with it. So first you people had the eye camp and then the diabetes and now the dental. I think this is something great that you people are doing. So we wholeheartedly thank you people for this initiative, and we as a team from the school are with you people in your efforts towards a healthy lifestyle. So thank you once again. Thank you, Dr. Kamal, for this wonderful presentation. And I think for the teachers who have not joined, we'll also be sharing the recording, and also your presentation will be shared with them. And as you said, Dr. Salim, that the link will be there. The WhatsApp group will be created, I suppose, so that the teachers can ask doubts over there. So we will go ahead with this. So the next week to come, the teachers will be doing the initial screening in their classrooms and then shortlisting the children who need intervention. So from us, thank you very much once again. Jazakallah khair.
Thank you, madam, for your kind gesture and support and your interest.
Before everyone leaves, Dr. Salim, please, I wanted to emphasize
Yeah.
that we will provide enough tongue depressors, and these teachers are going to use each one separate tongue depressor for each child.
Yes.
Yes.
Thank you.
Thank you, Doctor. Yes.
Just for 2 minutes, if the HM's administrative officer and I think principal sir was not able to join, if you can
Yes.
stay just to discuss 2-3 things regarding this, others can leave, please. Only the HMs and our IDMF court committee team.
Dr. Salim, go ahead.
Yeah. Regarding the, if you can, Dr. Kamal, please tell your requirements and how we can initiate the process. What about the inaugural function? Can
Sir,
you?
1 minute. I'm talking to the principal to join if he can.
Yeah.
So basically the
Just a minute, Dr. Kamal. Just a minute.
डॉक्टर साहब क्या हाल है कैसे हैं आप ठीक ठाक हैं अल्लाह आपको खुश रखे आबाद रखे
No, I think sir is offering Salah because it's Salah time. Yes, we can go ahead.
Yeah, madam, just basically what I was planning is that inaugural function will be in the main auditorium where at 10 a.m. in the morning. That will be fine with you, right?
Yeah.
And
Can we make it 10:30, Dr. Saab? Because the boys section children arrive at 9:30. So by 10:30, everything will be set, I think.
Yes.
Yeah.
Okay, no problem, madam. 10:30 we can make, and then in that we'll be distributing the certificates and the this thing for recording the what are the problems. That sheet will be shared with you. You will have to print that sheet and give to all the teachers and students. All the students should have. In that there will be 2 sheets. One will be the brushing technique, this thing, and the other will be like for the doctors to use for recording the problems. Okay. Secondly, I want, if anyone can from the school side, they can prepare a video of brushing technique which can be continuously played on the stage when the camp is going on, so that the children, they can see.
Dr. Saab, the school may not be able to prepare the video. We can get the video from the YouTube.
From animated,
YouTube, yes.
Animated
download
video
from the YouTube, which is more appropriate for our kids. And with the background commentary.
Yes.
So that we can not only display if it is their provision to do it, we can even send it to the parents.
Yes.
Every
Yeah.
class teacher has a parent and teachers group, and they can send it.
Yes.
Make it as much possible. I mean, like viral as
Simpler.
possible. Yeah.
Yeah.
Yes,
And
I think that's a good idea because displaying it on the screen, children will keep moving and they may not be, if they stand and watch, then there'll be a crowd management also there. So we can share this. I'm requesting principal to join. Okay.
yeah.
Assalamu alaikum, sir. Sorry, sir. Are you out? Can you join now, sir? Uh, can you join the meeting? Yes, sir. Uh, okay, sir, please. Yeah. Sir is joining. So I think, yes, we will circulate the video, which will be downloading from the YouTube. See, if one of
Yes.
the doctors tell us which is the best video, I think
Yeah,
then we will circulate
I
that.
will, I will share with you. No problem.
Yeah, yeah.
I will
So
share.
I think you people can give us the best video which can be shared instead
Yes.
of we taking randomly any other video, right?
Yes.
And
Okay.
also, there's a small idea. I just
Yeah.
wanted to take the help of other, like for example, if you have video in Tamil, background commentary, Malayalam background commentary,
Assalamualaikum,
then
Principal Sir.
वालेकुम
Walaikum Salam,
सलाम
you're
सर,
welcome.
हाउ आर यू?
जी जी.
कैसे हैं सब? ऑल वेल?
Alhamdulillah.
I just came out from the mosque actually.
Yeah,
Mashallah.
how is the weather outside, sir?
Weather is very pleasant, sir.
Okay. We are
How was
almost
the?
coming to the conclusion. We're just discussing with Nahid ma'am about our arrangements.
Mhm.
And anyway, whatever is missed, she will share with you. She will
Inshallah.
tell.
Yeah, sure. That's the reason actually she is there, and definitely we are looking forward to for the success of this, inshallah. And this
Ara
will be
madam is not there.
Sir, she was also
Actually-
not able to join
Actually,
because of
I
the limit.
tried to join this meeting at around 3:20, but it was already, 100 capacity was over, so I couldn't
Mhm.
join. And the same way,
Yes.
actually, she also couldn't join.
Yes.
Okay, that's
Yeah.
very true. Very true. Okay, anything else, please?
Madam, I mean, I just wanted to discuss if we can have some student volunteers during that time, because it's going to be taking place simultaneously both in boys and girls section, if I'm right, yeah.
Yes,
So
sir.
if there are, some volunteers, student volunteers, it's going to be 5 days, so you can keep them on rotation, and definitely, give them from our side, we can give them say certificate of appreciation as a volunteer as well. That's not a problem. But we need them for two reasons. One, they know the school and the kids; they'll be able to kind of organize them. And second thing, when we are doing the examination, we can train them to kind of note down what we are saying. Whoever is coming as volunteers, we just brief them on what to write. We'll just tell the tooth number or something. They can just note it down.
It'll
So
be an
if there is
experience
someone,
for them also.
without disturbing their class or something, if it is possible.
We
I'm
will
talking
try to
about
arrange the senior children as volunteers, sir. If they don't have exams and all that.
Correct.
Otherwise, we have group of volunteers of the 8th standard also.
Absolutely,
We can
that's fine.
put them on job to do it.
We are also bringing actually interns and all from other universities, because it's a large number. We have they'll also be participating. So basic thing, what our requirement will be just a torch and a wooden spatula just for the examination.
Gloves.
And the
Gloves.
forms, the class teachers know their students 40 or 45, whatever is it. I mean the numbers they can write. We will share the form with you. It's very simple. You just need to enter the name of the student and the class and section. The rest of all we will fill it up. So that when
In the initial screening, doctor, what do you want the teachers to fill in that form?
Nothing
Will
at
there
all.
be
No,
a kind
initial-
of checklist?
No, nothing at all. I shared the pictures. They will be just looking for discolorations, crowding.
Okay.
I mean, I can share the pictures again. You have the presentation.
No, I have seen that.
So they just
Yeah.
need no need to write anything. They can maintain their own list in a paper. Okay.
Okay.
So those students alone, when Dr. Salim sends the dental chart, examination chart, they can enter the name of those students and the section. And when the student comes to us, they can come with the paper, or the teachers can give the paper to us when the student comes. It's okay.
Okay, that's fair enough. I think you people can share that those sheets with us tomorrow so that we can start it right
Yeah.
away.
We will
Yeah.
will share today itself, madam. And if
Okay.
possible, if you can make one WhatsApp group or the previous WhatsApp group which we were having, we can revive that also.
Okay,
Yeah,
we'll have to check because
no,
we
ma'am.
have
We have an active teachers health awareness group.
group.
but
Dr.
those were the
Dr. Yamin,
teachers of 1 and 2 block, I think.
no, 1 to 5.
1 to 5.
1
Now
to
we
5.
have 3 to 8.
Yeah,
So
no,
3
no,
to
no,
5
no,
and
no.
6 to 8.
I'm sorry. I'm sorry to interrupt, ma'am.
Yes,
These
sir.
are the teachers who we had chosen. They were not necessary. They were class teachers. So now the
Okay.
group of teachers will be bigger, no problem. But those
Okay.
teachers who are not class teachers, and then those who are from 1 to 2 block, because 1 to 2 block is not included in this, let them be
Yes.
also there. It is just a matter of information, just a matter
So
of
we will.
education. Yeah. Don't
Okay.
remove anybody. Let them be
No.
there and add those who are not there in the group. This is
Okay,
number
doctor.
one. Number two, Dr. Kamal, I just want to correct you. I had a discussion with Dr. Salim Saab also. When the teachers will scrutinize and shortlist the students who need a professional screening, depending on the number of these students, we will divide our number of days of screening. Suppose we can finish in 3 days, it's more better than engaging the school for 5 days. That's what I feel.
Yes, I think that will be better.
And I know
Yes.
the numbers, ma'am, exact numbers, prior to screening, what are the numbers from grade 3 to 8? Both boys and girls section.
So I think if one of you are the admin of that group, of that already existing WhatsApp group, if you can just add me, then I will add the rest of them.
Yeah, great.
I
great.
will have to check. I will have to check.
Yeah.
Dr. Yamin is the admin. And
Yeah.
Okay, because I'm not in that group, so I don't have any idea about it. So if one of you can just get me added to it, then I will be doing the rest. Okay.
And madam, the timings of the camp,
Yeah.
because it's going to take place both in boys and girls section simultaneous. So what is the timing? We were thinking for the girls section from 9 until 1, at least 4 hours of screening. So what
Okay.
would be? We want to keep it like fixed on those days.
Okay, if it is 9 to 1 for the girls, for the boys, it should be 10 to 2.
Great, that's fine.
Yeah.
That's fine.
Yes.
Ma'am, there are 61 members in that group, IISJ School Health Program Group. So
Okay, doctor.
I am also admin. Dr. Salim is also admin. Dr. Farah Abdul Haq sir is also admin. Farah ma'am is admin. So
ठीक है then.
I think any of the admins can make you admin, ma'am. Correct?
Okay, fine. I'll tell Farah ma'am to add me.
Yeah. Okay. Thank you, ma'am. Thank you.
Yeah.
So I think we will conclude, Dr. Salim.
Yes, Dr. Sir, we'll conclude. Inshallah, everything will be best. Inaugural program, we have to consider that CG sir will be inaugurating.
Yeah,
So we have
that we
to-
will discuss again, Salim Saab. We will have another short
Yeah,
meeting
if
with
you-
principal and admin. And as of now, we have done a very good, mashallah,
Yeah,
presentation. I thank on behalf of IDMF to all core committee members of the school and core committee member of IDMF. And special thanks to Dr. Kamal and Dr. Salim and our AO. Thank you very much, everybody.
Want to
Jazakallah
add
khair.
on, sir, if you allow me, this
Yeah,
screening
please.
is also, we will take this as a chance. We'll be honored to screen all our teachers as well. So we will
That will
not
be
leave any
nice.
one of them, and all the staff members, right from non-teaching staff also, we will screen them, be it drivers or whoever it is. Yeah, all of them will be
Yeah.
screened.
In that case, we have to keep a separate session because we don't want to involve the drivers and non-teaching staff coming into the students' time. Students' time, yeah, is a very precious time because we have to finish them before the end of the school, 1 hour before
Maybe
they
the
go to the
last day,
classes.
last day of the camp, sir. Last day of the
Okay.
camp, we will keep this exclusively for them.
Inshallah, we'll see. We'll discuss.
Right. Thank you.
Thank you.
Thank you, sir.
Okay.
Thank you, madam.
Thank you. Assalamu
Thank you,
alaikum.
Principal sir. कहाँ है प्रिंसिपल साहब, चले गए?
I think he left.
बैटरी खत्म हो गई?
He left, I think.
जी
Yeah.
जी, चलिए,
Okay, then we wind up.
ओके,
Okay, Assalamu alaikum.
वालेकुम सलाम।